reports say Democrats and the president could go it alone on a health bill. But at this point, will their efforts be too little too late? Matt Taibbi puts this positive spin on health care in the latest edition of Rolling Stone magazine, writing, quote, this: the system doesn't work for anyone. It cheats patients and leaves them to die, denies insurance to 47 million Americans, forces hospitals to spend billions haggling over claims, and systematically bleeds and harasses doctors with the specter of catastrophic litigation. The cost of all of this to society in illness and death and lost productivity and a soaring federal deficit and plain old anxiety and anger is incalculable. And that's the good news. The bad news is our failed healthcare system won't get fixed because it exists entirely within the confines of yet another failed system, the political entity known as the United States of America.
Ooh.
Okay.
Good morning, Cincinnati.
Hello, everybody. Really, that's sort of just makes me feel good all over. What can I say? Good morning, sunshine.
That's my specialty, the feel-good story.
Good Lord.
You're an optimist.
Sorry about that.
It's unfixable. The system's broken. Washington can't fix it.
I mean, it looks like that. I mean, I think this was a real litmus test for whether or not our government can fix an urgent national emergency. They had a president who was elected with a sweeping mandate to change. They had 60 votes in the Senate. They had a vast majority in the House. They really could have done pretty much anything here, and they ended up really not doing anything. Well, that's assuming the public option doesn't pass, but that's the way it looks right now.
So if a public option doesn't pass, do you consider health care reform a failure?
Well, there'll be some good things in it, sure. I mean, not denying people who have pre-existing conditions, caps on, co-pays and that sort of thing. That's all good, but it's not meaningful. I mean, the healthcare system, 31% of the cost of our healthcare system is administrative costs, chasing claims, paperwork. And we didn't do a single thing to fix that, and we didn't do a single thing to drive down costs. I mean, those were the two big things we had to do. And the two options for fixing that were single-payer healthcare or a public option to drive down costs. And neither of those things are on the table.
You've seen the polls that show, though, that a majority of Americans are pleased with their health care.
Well, yeah, I've seen polls. You can pretty much make polls and say whatever you want. If you ask the PNPH, they'll say that over 50% not only of people but of doctors and hospital staff in this country favor single-payer health care. So, I mean, there are polls going both ways in health care.
Excuse me, but if the USA is so bad, why is it that if I were to get sick, or God forbid, one of my loved ones will get sick, the only place I want to get sick is America, and that the most innovative and the best drugs in the world come from the United States of America?
How come the United States isn't in the top 10 in any major category? We're 13th or 14th in infant mortality. We're for life expectancy.
We're obese.
We spend twice as much per capita as almost any other industrialized country in the world, and we have worse health care.
Well, let's talk about one of the public options out there, UK, for an example. The two best-selling, most important cancer drugs in the world, Erbitux and Avastin, UK government won't pay for. Oh, you need Avastin because you want to extend your life? Not going to pay for it.
Well, I think most people in the UK are far more satisfied with their health care than we are. I mean, most people who have bankruptcies in this country, it's because of health care costs, and most of those people have health insurance. 8 out of 10 people who go bankrupt because of health care costs in this country have health insurance. That points to a completely broken system. It's impossible to argue that the American system works in any way when 47 million of us don't have insurance, and the people who do have insurance aren't really covered.
I've got lots of criticism, and I'm skeptical of a lot of the things on the table, but for you to say America is not the place where you want care if you are sick, I have to put my hand up and talk about the innovation coming out of this country.
Would a Swiss person come to the United States to get his health care fixed? Would a French person, a British person? No. I mean, most industrialized countries in the world have better health care than us for cheaper.
We don't know that it's better health care. As I just said, there are certain governments that won't pay for important drugs. And yes, the system is broken. It's too expensive. There's no reason that, 16-week, allotment of drugs will cost you $40,000 or something like that. That's broken. But, there are governments making the decision about what drugs and what care you're going to get. I'm sorry, I don't want the government making the decision of what care I'm going to get.
Maybe you don't, but 47 million people in this country don't have any health insurance at all.
I have a problem with that number. 47 million Americans are uninsured because it's not. That's debatable also. Okay?
How is that debatable?
It's totally totally debatable because some of them are illegal aliens in that number. Other people are Americans working abroad. You haven't heard the debate that 47 million is not necessarily the number?
I have health insurance and I can't even go to a doctor when I get sick.
She's very hard to please, Matt. Don't worry.
By the way, I'm on your side, but I mean, when you say
I pay $6,000 a year out of pocket, and I can't go to a doctor. I have a trip scheduled to Brazil this year to go get a medical procedure done, and I have health insurance that I pay almost $7,000 a year for health insurance.
There are also a lot of Americans, though, and a lot of people across the globe, because I've seen these lists, we're 39th in health care, we're 18th. I can tell you that we've seen it for some time. When you have people across the world that can go anywhere for health care, a lot of them do opt for the United States. Now, that's because we do have the innovation, right? Maybe the problem, Ridley, is, though, that, of course, you've got, whether it's 47 million or 20 million or 30 million, you've got people, a large chunk of our population, who have to take their children to emergency rooms at midnight because that's their primary care provider.
Well, I think the question, we say best health care, and I would say we probably do have the best health care, but it's about access. Is everyone able to have access? Is there preventative care? So
if you're a managing director of Goldman Sachs, we have the
But that's what I'm saying. I'm not arguing with that. I'm saying, if I can afford to go, if anyone at this table has a problem, yes, we can probably get the best health care. But if you can't get access, is that the best health care? Is that what reduces us down to 39th in the industrialized nation? I'm not arguing with you. I'm saying, sure, it's the best. But if I can't get it, it doesn't matter.
The problem, and the question
the
is,
if I can't get it,
Matt, and this is, I think, why the president needs to flesh out what his plan actually is. Will our health care system, if we turn it over to the federal government, look like Medicare? Or will it look like, let's say, Veterans Affairs, where I can tell you VA health care is just horrific.
It's better than not having it, though. It's better than not having any health insurance at all. It's better than the system in New Jersey where half of the hospital administration in Bayonne, New Jersey is devoted to chasing claims. It's just totally inefficient. It doesn't work.
Taibbi, your article in the latest issue of Rolling Stone. Thank you.